I was on call last night and didn't get a single call. So super excited about that. And this morning, I am having my chai. And wherever you are in the world, grab your cup of chai and take a seat. And we're going to talk today about a very common topic that comes up in the office all the time. And so share with a friend, invite them to come along. We're going to be talking about vaginal infections. I know, very sexy topic, but really, really common and kind of an annoying thing for many patients. So um, I would love to answer questions along the way, and we'll get started. Okay, so, all right. I'm Dr. Cheruba Prabakar. I am a board-certified OBGYN in the San Francisco Bay Area, and today we're going to be talking about vaginal infections. What are the most common symptoms? What are the treatments? And how can you prevent it? Okay, so this is a super common topic and something that I see in my office all day, every day, and something that is of great distress to many patients, understandably. When you're kind of feeling irritated on your vulva, you can't wear tight jeans or your pants, or you're itching and you're in public, and the whole thing is just, it's just uncomfortable. You can't focus on your work because you're always itching. So many patients see gynecologists because of this, and I want to go over a couple of key infections that we see all the time and why they're caused, and what we can do about it. So the most common symptoms that people present with when we talk about vaginal infections are itching is probably number one. The second is vaginal discharge. And the third is just irritation. They don't quite know what's going on, but something's not right. The vulva or the vagina just feel really irritated. And so when someone like that comes to my office, I ask them a bunch of questions. What triggered this? Did you go swimming? Did you recently have intercourse? Did you use a new soap or a detergent? New underwear? What do you think could have happened? And sometimes there is a clear trigger that started all of this, and other times, there's not. And then we talk about itching. Are you itching, or is it just irritated and there's really, no itching? And then we talk about vaginal discharge. Is it associated? Is this irritation associated with discharge or not? And so it gives me a better idea of what's going on. And also, as I previously mentioned, did you have intercourse? Is it one partner, multiple partners? Because when we think about vaginal infections, I'm also at the same time thinking about sexually transmitted viruses and diseases that can also present with some of the same symptoms. And so after asking a bunch of questions, then we do an exam and we look for any discharge. Is it clear? Is it white? Is it yellow? Is there a smell associated with it? And I just look at the area to see how irritated it is. Is it red? Have they been scratching so much that there are just lines and little gashes everywhere? And then we often do a swab, which is literally like a COVID test, kind of a swab that we swab the vagina with, and we send it to the lab. Sometimes we put this on a slide and look at it under the microscope to see if we can see some evidence of infections that we can treat right then and there. And so when we talk about infections, what are the most common ones? So bacterial vaginosis is probably the most common thing that I see. It's called BV or bacterial vaginosis, and it is a vaginal infection that can cause itching and discharge and kind of a fishy odor. And it's caused due to the change in pH of the vagina. And so this can, again, be caused by several of the things that I mentioned before, which are a new partner, or swimming, or a new detergent. Anything that changes the pH of the vagina can cause bacterial vaginosis. And this is, many patients ask, is this sexually transmitted? And for decades and years, we've always been taught that it is not sexually transmitted. But just 2 weeks ago, there was an article in the New York Times that said, maybe it is sexually transmitted. And if we treat both the patient and the partner, these symptoms may not come back. And so this is a new thinking right now. I'm interested in seeing what the guidelines say in terms of treatment, but there's some shift in the way we think about this at the moment. But the bottom line is the treatment is antibiotics. You can take them orally, or you can use them as a gel in the vagina if that's more comfortable. And it's about a week's worth of treatment. And usually after that, patients are feeling much better. Sometimes they can recur. They can recur after a few weeks, sometimes a few months. Sometimes it happens right before your period or right after your period. Again, it's because of the change of the pH of the vagina. So that's the most common one that I see, BB. And then the second one is yeast, which is also very, very common. And I think a lot of the go-to diagnosis for many women is, oh, I have yeast. But maybe you don't, and that's why you should go see a doctor to really figure out what's going on. But yeast can also present with itching, and oftentimes you'll see white, kind of thick, classically known as cottage cheese type discharge that comes up in the vagina. So there's a thick discharge, there is itching, and then there's usually no odor. And sometimes you can get it after taking antibiotics, because antibiotics can suppress the good bacteria, and again, the pH is changed, and yeast can grow. So and yeast is a much simpler treatment. You just take one pill, and it's usually takes care of it. We also have a vaginal cream that we can use. Many of you may have used Monistat, which is the over-the-counter medication that we use for yeast. So those are the two most common infections: bacterial vaginosis and yeast. They can both be picked up by a swab, and usually just by clinical diagnosis. Once I take a look, I can usually tell if you have one or the other. And then we don't have to, repeat the swab to make sure that it's gone or anything like that. We just go by patient symptoms. Usually patients will say, oh yeah, like I feel fine after a few days of the treatment. So those are the two most common. And there are other infections that are STDs that can also present with vaginal discharge or irritation, or even actually lesions or sores or little bumps. And so, especially if you have those, it's really critical to see a doctor to get it checked out. And these can be things like trichomonas or herpes or HPV warts. These can also come up, and these are STDs. And so we usually have a more lengthy conversation about prevention of transmission, et cetera, to your partner. So these are some of the most common ones. And of course, I forgot to mention gonorrhea and chlamydia. Those two are really common amongst the STDs. And if you do have one of those, you should get treated as well as your partner. And they can have some long-term repercussions in terms of fertility and other things down the line. So we definitely want to be careful and using protection so you can prevent yourself from getting gonorrhea or chlamydia or any of the other STDs. But as far as BV and yeast, these are the most common complaints that women have when they come in to the GYN's office with itch or vaginal discharge. So that's kind of a quick rundown on vaginal infections. I would recommend, if you're somebody who gets, in general, a lot of vaginal infections, to talk to your doctor about maybe taking a probiotic. There are drinkable probiotics that are fresh cultures of good bacteria. There are also pills that you can take on a regular basis. And so I would look into that if you're somebody who gets recurrent infections. And if you get 5 or 6 more infections in a year, you may also want to talk to your physician about getting screened for diabetes, especially with yeast. I've definitely picked up diabetes in the office when the presenting complaint has been an yeast infection. So, if you're getting frequent infections, this is something that you want to delve into a little bit deeper and maybe get some blood work and see what else could be going on that's predisposing you to these infections. But if you have one of these, just know that they're common, they're easily treatable, and you want to support your immune system and your health by either probiotic or removing what could have caused that in the first place. So those are my tips and tricks for vaginal infections. And I would love to take any questions from you guys, if there are any. Let's see. Wonder if there are any. Hi, Deborah. If there are any protective practices to decrease incidence or support a healthy vaginal microbiome? Yes. So this is a great question and comes from the roots of this really come from maintaining a very healthy diet. So I personally recommend, and research has shown that a heavily plant-based diet helps for all sorts of diseases, acute or chronic, but especially when it comes to the vaginal microbiome, eating a non-inflammatory, healthy diet is very good. And then making sure you wear kind of looser clothing. I know it is a style to kind of live in yoga pants these days, but some of those tight pants, and then if you work out in them and then don't really change, that can also upset the microbiome because of excessive sweating. So that's something to keep in mind. And all of the things that we do for healthy lifestyle in general is what we should be doing for the vaginal microbiome as well. For those who are kind of perimenopausal or postmenopausal, estrogen decreases in the vulva and the vagina, and this can also start predisposing you to infections and just irritation and itching. And so for these, in these cases, I do suggest that you speak to your physician about using vaginal estrogen, which is a really great medication and can really restore the microbiome and the architecture of the vaginal epithelium and prevent infections. So that's another tip for those who are perimenopausal or postmenopausal and find that you're getting infections. And even if you're not, it's just a good tip to maintain the microbiome. So that was an excellent question. Anyone else? How can I protect myself from infections from intercourse? So this is a great question, and I would highly recommend that you use condoms for protection. So you may be using another form of birth control, like pills or the ring, or maybe your partner had a vasectomy, or maybe you're not even at the age group where you can get pregnant, but you're still concerned about STDs, as everyone should be. And I would definitely recommend using condoms. Now, one thing I will say is that human papillomavirus, or HPV, can be spread even just through general contact. Condoms definitely decrease this incidence of spreading, but it's not 100%. So that's something to think about. And I've talked about this before, but many women say, oh, well, my partner got tested for all the STDs and he's negative, so I'm good. I want you to know that in the US, men do not get tested for HPV or human papillomavirus. So they may be negative for other, STDs, but they don't know their status with HPV. And so it's best to protect yourself by always using a condom. Okay. Thank you. Thank you. Any other questions? I know we started our show a little bit early today. And so some of our usual viewers are not here. So if you are catching the replay or watching this at a later time, definitely send us questions and I'll make some content to answer those questions. How do hormonal changes like those during pregnancy or menopause impact susceptibility to vaginal infections? Yes. So pregnancy and menopause definitely can make you a little bit more susceptible. In pregnancy in general, your immune system is a little bit lower, which is why strange things happen in pregnancy. Like you've never had a abnormal pap or HPV, and boom, now you're pregnant and it's abnormal, because your the ability of your body to fight off infections is a little bit lower, and so it is possible to also get some of these infections a little more easier, and it's super important to treat them. The other thing during pregnancy is also UTIs. UTIs can also become really common, and it's really, really important to not blow these off, because we know that there is a link between BV, bacterial vaginosis, and preterm labor, for example, in the third trimester. So we want to make sure that we treat these infections in pregnancy. And then menopause, because of the lack of estrogen, bacteria can definitely cling on a little bit easier to the urethra, causing UTIs or urinary tract infections, but also yeast and BV because of the altered pH. So using vaginal estrogen is a great idea. Can over-the-counter treatments effectively address all vaginal infections, or are prescriptions sometimes necessary? Um, in a quick pinch, I think over-the-counter treatments are okay for especially yeast infections. We don't really have anything good for BB over-the-counter. But for yeast, there are a couple of different options available. And you may find that that's all it takes. But if you have something a little bit stronger, or it's not going away, and maybe you have one or two infections together, then that's time to see someone to actually get a swab done, to really identify what's happening there. But yeah, a lot of patients first try something over the counter for yeast, and then come to us. The only thing I will say with that is you don't really know what you're treating. I mean, just because you're itching down there doesn't mean it's yeast. But for some people, they know, they've been to the doctor about this before. They have the classic symptoms, and sometimes you can get it taken care of. Okay. Any other questions about vaginal infections or prevention, treatment? Um, okay. So if no one else has questions, we will wrap up today. And again, if you are catching this at a later time, or the replay, we usually start at 8:30, so we're a little bit early today. So if you're catching this at a later time and you have questions, please send them to us, and either through YouTube or Instagram or Facebook, and we will make some content for you. All right, everybody. Have a wonderful Thursday, and we'll see you next week. Bye.